This year, Healthwatch Camden has given priority to mental health. It features in many of our projects. We've joined users from the Camden and Islington Mental Health Trust's Patients' Council on their regular ward visits, and we've had meetings with senior staff at the Trust to follow up what they are doing about quality and safety. We share what people tell us with decision makers, and we were pleased that Camden's Health and Wellbeing Board has now made mental wellbeing one of its 5 priorities. We listened to service users at the Health and Adult Social Care Scrutiny Committee, who told us they were worried about service changes, in particular to the Highgate Mental Health Day Centre. We are now working with the service users to make audio diaries of their experience, which we will use as evidence of the impact that service changes are making.
Our piece of work on the Highgate Day Centre is a research project that's designed very specifically to gather some very robust evidence on the experience of service users over a very important service change that's taking place in our borough here in Camden. And the reason we're doing it, and the reason I feel very strongly that this is a really interesting and useful piece of work, is that we're very used to hearing policymakers and commissioners and service providers have to explain that a service is going to change, particularly in this day and age when many services are being hit by budget cuts. So changes are unavoidable, but sometimes the changes are because there's new thinking about a better way to deliver a service. And then we hear the explanations of how those changes are going to be implemented. But again and again, we hear the service users saying, "That's what you tell us, but the reality for how we experience these changes is very different from what you say." And it's that evidence gap between the policy or the plan and the real lived experience of the service users who are having to go through those changes that we want to capture in this project. We designed the project with the service users, and I really hope that the results of it are going to be useful in terms of what is learned, not just for the people who are actually having to implement this particular change to the service at the Highgate Day Centre at the moment, but also to others in the future who, for various different reasons across various different services, are going to have to be implementing changes.